Welcome to an overview presentation of the different accrediting organizations that can conduct the initial Medicare survey for a home health or hospice agency in Texas. My name is Dr. Kimberly Kelly. I'm a registered nurse. I am the CEO of Compliance Review Services. We established the company in 1997, so we have been consulting for 24 years. We are presenting to you today a little bit of an overview for Joint Commission, CHAP, and ACHC. These are the three accrediting organizations that you can hire to come in, and you can pay them to complete your initial Medicare certification survey for home health and hospice. Right now, Medicare is not allowing the state surveyors in Texas to do the initial Medicare surveys, so they are contracting them out. This is just to be a guideline to you. We do recommend that you contact the accrediting office directly. When we provided the information for Joint Commission and CHAP and ACHC, so you can reach out to them to get their current pricing. As their pricing does change, as of 2021, a lot of our clients' feedback is the cost can be anywhere from $9,000 to $12,000 to have them complete that initial Medicare survey. And that might be accreditation fees and some consulting fees combined, not including the man hours required by the staff to complete the work. So you really want to have an overall budget, in our opinion, of between $10,000 and $15,000 to allocate towards that initial survey and the time it might take to prepare. We hope that this presentation is helpful to you. If you'd like to provide some feedback to us, please email info@compliancereviewservices.com and let us know what else we can do to make it a little bit easier for you as you start your journey. Thank you. So as we were talking about in the introduction, the Joint Commission, CHAP, Community Health Accreditation Program, and ACHC are the approved accrediting organizations in the state of Texas for initial Medicare surveys for home health, hospice, and DMEs. There are other DME accreditors that are approved. HQAA is one of them. There's a whole list if you go out to the Medicare website. So the Joint Commission is an organization that has their own standards of care, and these are above the minimum standards for the state and Medicare. They're an organization that business owners pay so that they can come in and do the initial survey and certify the agency for Medicare. Outside providers know that your company has exceeded the minimum standards of care to attain that gold standard. And right now in the state of Texas, Medicare has rescinded the right for the state surveyors to do the initial surveys, and that's been in place for quite some time. So they're using the accrediting bodies to do the initial surveys. In Texas, our surveyors are very far behind on surveys, and when you add the pandemic into the mix, we just had a client who started their PAS business in 2019, and they just received their initial survey for their license that they got. So that's a pretty long period of time. Joint Commission's contact information is on this slide. Phone number 630-792-5800. They used to be called JACO, and they changed their name to be more formal, and they go by TJC now, the Joint Commission. They offer a variety of different accreditations: hospital, home health, hospice, ambulatory care, mental health, DME, and one of the newest ones is assisted living, and we have a slide coming up to share that with you. It's also on their homepage on their website. They offer deemed status, which is where they are going to do your initial survey and you become Medicare certified. So that's referencing the word deemed, means with Medicare certification. Regular status, that's when they come back every 3 years. It's called a triennial visit, and they will audit, and they'll audit not just for the state, but for Medicare as well. And then periodic reviews, they'll do random surveys on off years. They just randomly choose different companies and they come out and do surveys. So this is their current page today, where they're advertising that they're now accrediting assisted living communities, which I personally think is pretty amazing. It definitely would put your assisted living ahead of the rest if you're certified and have that credential behind you. They do have 2 different survey processes. You can do what's called a 2-step survey. This is if you want to get familiar with them kind of in a slower pace, and you can have them come out and do the administrative review, which is your policies, procedures, your personnel files, looking at how the company is set up, your infection control and safety procedures. And then they'll come back in 4 months after you've admitted your clients onto service, and they'll make sure that, by auditing the records and looking at everything, that you've met the Medicare criteria. They will provide an announced survey date for all the scheduled surveys when you're doing a 2-step survey. If you're doing a 1-step survey, they're going to come out, it's going to be unannounced, and usually in the portal, you'll have a Joint Commission online portal. You'll see a picture and like a little email or a notification from your representative that the surveyor is coming that day. So contact them for the options that are going to be your best fit. The fees for the Joint Commission need to be quoted by the Joint Commission. They do charge for like hotel, travel, flight. You can contact them directly. Our clients share with us that the average cost is between $9,000 and $12,000 for an initial survey, irregardless of who they're using, Joint Commission, CHAP, or ACHC. So again, contact them directly so that you can get that pricing. CHAP is the another type of agency or organization like Joint Commission. They have those standards of care. They exceed the minimum standards. They're a private entity, and again, you pay them as a business owner to become surveyed and hopefully certified by them for your Medicare. They have been around since 1965. They were essentially the first accrediting body for community-based health organizations in the United States, and CHAP stands for Community Health Accreditation Program. You have to have a legal authority to operate to be accredited by any of these accreditors. You want to be providing one or more service that meets the Medicare criteria. All of them have applications and fees and processes that you have to follow. And they will come back and do follow-up surveys. Each one has a little different guidelines as far as what's in their contracts. So you'll have to do your own homework and see which one is the best fit for your company. CHAP conducts the accreditation just like Joint Commission for a variety of different organizations. ACHC is the 3rd accrediting body in Texas that can come out and do your initial Medicare survey. Their phone number is 919-785-1214, and their link to their website is here with a lot of information on it. ACHC is again a nationally recognized accreditor, and they, since 1986, have been focused on helping companies demonstrate their highest standards of performance and patient care through their educational collaborative approach to accreditation. We have worked with ACHC with a couple of our clients, and we have found them to be very easy to work with, very straightforward. They do have on their website a step for the Texas ACHC hospice accreditation preparation. And there's other links on their website as well. And they have a lot of great resources there. So why does one choose accreditation if they're not Medicare certified? So if you have a licensed home health agency, say with a pediatric base, a lot of the private insurance companies want to see that the business is accredited. They want to see that they've met that gold standard and that somebody is auditing them with some rigor. So that gold standard is marketable to the public, and it's also marketable to the payer sources. What we recommend is, to try to get your licensing done timely, to use ACHC or Joint Commission. That's just our experience. We found them to be a little bit easier to work with. They don't have the self-assessments or self-studies like CHAP has. CHAP does highly recommend that the agencies go through those self-studies, which can really be a lengthy process, trying to make sure that you have everything ready for the surveyor, and then copying all of those policies in the order of the standards can be very, very time consuming and overwhelming for new business owners. And a lot of our CHAP clients have to go through that process. So we just find ACHC and Joint Commission just a little bit more efficient. We offer policies and procedures, forms, job descriptions, quality management programs, staff and management education, leadership training, preparation for survey, report writing including graphs and statistics, and outcome-based quality measuring and monitoring. We also do the licensing applications for the state in TULIP, the CLIA apps for your lab for blood sugars, and in the PACO system, the Medicare 855A. We work primarily as a consulting firm with home health, hospice, DME, and